It's Pat O'Connor here, just checking in with you to see how your improvement project's coming along as part of the EQIP programme. We want to see, are you managing to use the tools and techniques? Are you doing tests of change? Have you got a clear aim for this project to be completed by March 2022? And have you managed to put together an overall plan in your driver diagram template? So as part of your project, what you're already working on is, where is the problem? You've identified that now. How do you know it's an issue? You've probably used some tools and techniques for diagnosis. What does that data tell you? Where's the most difficult issue, or where can you make a difference by March? What tools are you using locally to diagnose the gaps? And what are the patients and families saying about the system that you and services that you provide? So one of the ways in which you can do this is you can look at process mapping, a tool in diagram form that identifies where in the system things are working. It uses symbols at the start and end of the process and some diamond shapes where decisions are made. Here's an example of one that you might map the flow process for patients coming to the clinic for their diagnostic tests and where they end up. Are they discharged? Do they come back to the view clinic? It helps you to see where things are working well and where there are opportunities for improvement. We want you to have a clear aim statement for this project. How good by when? In one sentence, and the project must be complete by March 2022. Try and embed it in your day job because that makes the work easier to do. So here's a couple of examples of aim statements: to develop and implement a transition process in co-production with children, perhaps aged 14 to 18, and families in a trust by March 2022. To reduce the waiting time for first clinic visit by 50% for the cohort of children most at risk by March 2022. So we'd really like you to put your aim statements in this format, in one sentence: how good by when. You may want to put together an overall plan for the whole project in a driver diagram, and we've given you an example here. We had a chat very recently with the Warrington team and we put together this draft driver diagram from some of the things that they told us. So they want to engage with families to improve mental health care pathway by March 2022. We'd need to be a bit more specific than that, but this was a first draft. They know that holistic care will be a key driver, that information and support for families struggling with diagnosis will be essential to make that happen. They'll need robust methods of engagement. So these are the key primary drivers that will make or break this project. And then they've tried to identify some of the secondary drivers that support that and put together a small list of ideas for change where they can test things out to see if it's going to make a difference. Here's another one from the EQIP 2019 programme where they were looking at EEGs in 95% of children, and they wanted to do that by May. Again, the key primary drivers are there, the secondary drivers are there, and the key ideas for change. So have a go at putting your project on a driver diagram. It really is an easy way for you to communicate with everybody in the system that you're working with to make these improvements happen. Now, there's always a method of change, and we've suggested in EQIP that you use the model for improvement. We mentioned it at the launch, and I just thought I'd put this slide in to help you to understand what are you trying to accomplish, how will you know that a change is an improvement, and what changes can you make. And at the moment you're doing small tests of change, aren't you? You're working with one patient, one family, one nurse, to try and see where you can make changes happen. Sometimes these changes work, so you might want to test something, try it out, adapt it a little bit. You may need to adopt it from someplace else, or in some cases abandon the plan you had altogether. We did talk to one team very recently where they tried to do a survey and they weren't getting any responses. So The idea in improvement is you don't spend any more time putting together a more detailed questionnaire. You just decide to abandon that and use a different method. So we hope you're getting on with your PDSAs, your Plan, Do, Study, Act cycles, your testing change. You're beginning to think about what you're going to measure in this project and how you will know it's making a difference. Did it work when you do a test of change? And what's next? So I hope you enjoyed the video and we've not taken up too much of your clinical time, and this video has given you a little push in the right direction along your improvement project road. Thank you.